We might have discussed this in the past. Have you done any Prolo for Ehlers-Danlos or Perineural for Fibro?
Yes and yes, and both positive. Ehlers-Danlos is obviously tricky because you're fighting an uphill battle, right, against the genetic component, but we do see positive benefits. The really tricky part is it's so widespread and throughout the whole body, and those patients tend to flare more than the average patient does. And I don't know if that's because of the disease or what the particular reason is, but the trend that I've seen in talking with other docs is that they flare more. And so when I have a patient with EDS, my approach is we're generally not going to treat more than 2-3 areas max. And that's just depending on, like, you know, if it's like, if we are including like all of the low back and SI, like that's all we'll do. If it's like both ankles and a shoulder, then I'm okay with that because the ankles are smaller joints than doing, you know, a whole bunch of levels in the spine. And then we just slowly chip away at it because they're going to need multiple treatments and you're going to have to partition out. So I generally just ask them what's your worst 2 to 3 areas pain-wise and instability-wise, and we start there and then we focus or continue to improve. With fibro, so Perineural can work really well for fibro, but it's still a Band-Aid treatment because you've got a systemic thing going on, and I'm a big believer in that a large majority of patients with fibro have some past trauma that they their body has not properly dealt with, and so I think that's a huge component to their healing is figuring out that, you know, past trauma and resolving it or working through it and that type of stuff. So, but in an interim, the perineural injections can be really beneficial. Same with, and I'm actually starting now to do more nerve hydrodissections than perineural, because for example, if we have, you know, pain that is basically the whole lower extremity, the whole upper extremity, if we come upstream and we can nerve hydrodissect saphenous, and we can come and do common peroneal, and we can do sural, then we can do kind of one location that can affect a whole area as opposed to doing, you know, 30 to 40 pokes in an area when patients are already hypersensitive to that.